All right, let's talk about something that can sound, well, pretty scary. You hear your doctor say the words ovarian cyst, and your mind just races, right? You're probably thinking, oh no, do I need surgery? What does this mean for having kids down the line? It's a totally normal reaction. But today, we're going to cut through all that worry and get some real clear answers.
We're going to break it all down. First, we'll cover what these things even are. Then, we'll talk about what it means if you're younger, when you actually need to be concerned, how they can affect pregnancy, and finally, what the whole treatment process looks like.
Okay, first things first. Let's build a really simple foundation. What are we even dealing with here?
It's the big question, right? But I promise the answer is way less scary than it sounds.
So, at its core, an ovarian cyst is just a fluid-filled sac. That's it. Think of it like a tiny blister that forms on or inside an ovary. I actually love how some people call them water sacs. Doesn't that sound so much less intimidating? It's a great way to picture it, and it really helps take the clinical fear out of it. And here's the thing you have to remember. They are super common.
Now let's zoom in on one group in particular, younger women. Because for you guys, the reality is almost always a very reassuring one.
Okay, this is a really important point to clear up. The word cyst gets thrown around, and a lot of people immediately jump to PCOS, or polycystic ovarian syndrome, but they're not the same thing. PCOS is a hormonal condition that involves lots of tiny cysts. A functional cyst, which is what we're mostly talking about today, is usually just one single little sac that pops up during a normal menstrual cycle.
And here's the key takeaway. For the huge majority of young women, these cysts are just functional. They're a totally normal part of your body doing its thing. They're harmless, and guess what? They almost always just go away by themselves in a month or two. No drama, no treatment needed.
But, of course, we need to be smart about this. So when does a cyst go from being a non-issue to something that needs a doctor's attention? Let's talk about the red flags.
You really only need to watch out for a few things. 1, if an ultrasound shows it's growing really fast. 2, if it starts to change from being just fluid-filled to something more solid. And 3, and this one is a big one, if you get hit with sudden, really bad pain. Any of those things mean it's time to call your doctor right away.
Now, when it comes to size, there's kind of a magic number doctors look out for, and that number is 5 centimeters. For perspective, that's about 2 inches. So if a cyst gets bigger than that, it doesn't mean something's wrong, not at all. It's just a little flag that tells your doctor, hey, let's keep a closer eye on this one. It's all about careful observation, not immediate alarm.
All right, let's move on to the other big worry, the one that keeps a lot of people up at night. What does all this mean if you're trying to get pregnant? I mean, this is a huge deal. You get this diagnosis and your mind immediately jumps to the future. So let me just ask it plain and simple. Does having a cyst mean you can't have a baby? The short answer, almost always, no.
See, it really comes down to what kind of cyst it is. Those simple functional cysts we talked about, they have basically zero impact on fertility. They just come and go. Now, if the cysts are linked to something like PCOS or endometriosis, then yeah, those can sometimes mess with ovulation. And in those cases, your doctor will step in with a plan to help get everything back on track so you can achieve your pregnancy goals.
Okay, so what does a treatment plan even look like? Let's map out the journey, from the moment you're diagnosed to the moment it's resolved. So, the path is usually really cautious and logical. It's not this big, scary rush to the operating room. First step is always an ultrasound. And then, you know what the most common next step is? Doing nothing. Seriously, it's called watchful waiting. You just come back in about 3 months for another look to see if it's gone away on its own. If it's still hanging around, then maybe some medication gets discussed. Surgery? That is way down the list. It's truly a last resort, not the first thing anyone jumps to.
So if you remember one thing from all of this, let it be this right here. Say it with me. Not every cyst needs surgery, and not every cyst gets in the way of your fertility. This is, for the most part, a very manageable condition, not a crisis.
And that's really what this is all about. It's about changing your reaction from panic to preparation. Once you understand what's going on, you know the signs to look for, and you know the typical steps, you're no longer just a worried patient. You're an informed partner in your own health. And that knowledge, that's not just power, it's peace of mind.